He's been heard to call himself a refugee from the bureaucratic mandates of Obamacare. He considers his experiences with the third-party payment system throughout his practice years as incentivizing him to make the rare choice to forego any medical insurance. Please welcome Dr. Gil Robinson.
I want to give a shout out to Twyla. I think she reminded me why I'd taken such an extreme step. And I pulled this out of my pocket. When I fly now, I use my passport card because it's not a real ID. I don't know how that is better than a real ID, but she told me this. So I just wanted to recount to you my experiences as not having insurance. And I think it's relevant to us because really, it's great to go without insurance as a doctor, but if patients are insisting on insurance, it's hard to grow. So how and why did I become insured? It says press this button. The clicker. Okay. All right, I'm thinking that slide 1 of 8, I'm thinking that changes it, but it doesn't.
Yeah, no, it's not. You have to.
Okay.
Okay, space bar.
Space bar.
Or you can click no, that's the laser. There you go. There you go.
Okay, well, this is going to play out slowly. So my last 12 years, nursing home only practice. In January 13, at the end of January 13, I closed my practice. I kept my group insurance, and you can see how much I was paying. And that went along for 2 years when they dropped me. They figured out I was the sole whatever they decided. I was gone. So I switched to an Obamacare policy. Pretty much bare bones, just the health, the required annual exam, plus Sendero taking up other stuff. Sendero's a sharing type. I don't think it's like a sharing ministry, but I think it's pretty not religion-based. But I never did anything but send the money. And so at this time, I was almost Medicare age, and I said, well, is this going to persist? Yeah, it should. It'll be okay. So also I had an HSA then. So my total cost from January 2013 until when I got dropped in November of 16, $45,000. Claims paid by insurance, 0. All my costs were out of my HSA. I didn't even bother submitting claims. I knew I wasn't covered. So that was all well and good. As I approached the Medicare age, I was 2 years shy of it. Sendero said, well, we told you it wouldn't make any difference when you get to Medicare. Well, we changed our mind. So basically in November 2016, Trump was elected. I got dropped, and I was 2 months from Medicare age, and I said, I'm just going to wait. Just not in a hurry to sign up for Medicare. And Twyla gives me some courage from her talk here just a minute ago, but it's still something that most people wouldn't do, I guess. So I just let it slide, and so I was, having worked in a Medicare Advantage plan for 6 years, I certainly was never going to sign up for that. So is insurance even a good deal? Are they incentivized to get the best price? Short answer is no, they are not. You may or may not know the Obamacare loss ratio mandate stating that an insurance company that collects insurance or that collects premiums has to spend 80% minimum of the premium on medical claims. So this basically tells them they've got a 20% profit margin. And that's incentivizing them to raise prices. There's our anti-hero. What I'm talking about is what we call the charge master right. I call it price discrimination. But if you're uninsured, they're going to charge you this charge master rate. It's very high. Nobody pays it. The insurance companies don't pay it. Medicare, Medicaid pay what the heck they want. But if I'm uninsured, I have no pricing power. Go back to 2006. This is the surgery I had. I went into the hospital, paid my $5,000 deductible, spent 60 hours getting my lumbar laminectomy and rods. And the next month, the hospital said, you owe us $63,000. You're denied because you had neck surgery. Well, my insurance agents fixed this fine, but here's the kicker. The month later, the hospital sent me a note and said, well, we got $28,000, and plus your $5,000, that's $33,000. We're happy. Please use us again. So they accepted 48.5% of what they wanted to charge me. Anyway, I wasn't eager to sign up for Medicare. So go forward to 2018, and I'm still haven't bothered to go down and sign up. I just kept finding reasons why not to, and my medical costs were okay. My hematologist said, well, I want you to get an iron infusion. Okay. And he says, but wait, you need insurance approval. Like, not me, I don't care. How much is it? $500. Free afternoon. I'll go downstairs and get it right now. No sooner did they put an IV in me than the clerk showed up and said, no, it's $2,000. What about the $500? Well, that doesn't apply to you. You're uninsured. It's $2,000. So out comes the IV, and my girlfriend's a social worker in a hospital, and she easily found me an infusion for $400. So I think I'm smart. I've gotten away with this, except that at the end of the year, the insurance, the infectious disease group where I got the infusion sent me out of the blue $4,200 bill. For what? I don't know. They said it was a consultation with the doctor who had advised that I could get it done there. I'd never seen the doctor. I wouldn't even, if I was making rounds on the same ward, I wouldn't even know her. So they billed me 3 times. It went away. They never threatened me. And that's something that happens to me as uninsured. I get these really weird, very high bills occasionally, and I typically just don't pay them. I don't respond. And more often than not, they go away. I'm not recommending that to anybody, but that's just my experience. So things changed in January. Since January 1, 2019, things changed in 2019. New Year's Eve, I'm in the emergency room. I've got, quote, flu and dehydration was the diagnosis. The PA comes in and says, hemoglobin's 8, under 8, and you're microcytic. I'm putting you in the hospital. Like, no, you're not. I'm going home. Of course, as quick as the holiday weekend was over, I went to see my hematologist. We got a colonoscopy, and unfortunately, I had colon cancer. And so I was in early February scheduled for my surgery, and the day before, I went in to get my bill paid. If you're uninsured, you really need to prepay your bill always. I carry my checkbook every time I walk into a provider's office. I always pay up front. If you don't do that, they're not going to give you a cash discount. So how much do I owe? $68,000. And I'm like, it's a little bit high, but that covers everything, right? No, it doesn't. Your entire stay will be $110,000. At which point I'm like, no, that can't be right. I know about charge masters. I know that that's not what everybody else is paying. And the clerk immediately answered, you're right, because you are a healthcare professional who's practiced in our system and are paying cash, we can discount you. What do I owe? $11,000. $11,000. So I wrote a check. They gave me a receipt. That was it. I walked out, came back the next morning, and got my belly split open, and fine, all was well. A year later, I had a recurrence, had to go back for a laparotomy. Again, it was local recurrence at the site of the original surgery. That time, they didn't even try the $110,000 trick. They must have had an asterisk in my record, because they gave me they billed me for, I paid the day before again, and what they billed me I thought was very reasonable, and I paid it. And honestly, I don't think they recovered cost at $11,000, but that's their decision. So after the second surgery, I was going to have chemo, and that gave me another lesson to impart to y'all, or another story to tell. I had to get a Mediport, and that was outpatient surgery center. It was several $1,000s, and I was charged that. I thought probably what everybody else did, so I'm happy. Then the chemo pricing threw me for a loop. I have many stories I can tell about this discrepancy of pricing, but this will be the last one. The FOLFOX regimen was pretty reasonably priced. They wanted $1,200 for treatment for 12 rounds of it, and I'm like, okay, I can do that. The first surprise was when I went for my first treatment. It was $1,900. Well, where's the $700 upcharge? That's for that powerful antiemetic you're going to get. Like, okay, well, what if I just take Zofran? You'll be sorry. So fair enough, I signed up for that. But the real, the 90% discount thing came in again. My oncologist wanted me to take Avastin. $7,000 a dose times 12, $84,000, more than the other treatments. Well, I'd done some reading to look at all these colon cancer regimens, and Avastin is right-sided, for right-sided, and it was somewhat controversial whether it should have been approved for cancer, because its effectiveness was disappointing compared to the theory that it was going to be a miracle drug. It provided me no survival benefit and a 5% increase in disease-free interval. So I said, thanks, Lon, but no thanks. I'm going to pass on that. This sort of bothered him, so he said, okay, I'm going to give you a Medicare allowable charge for all your care going forward. So I go down to the billing unit, and they say, well, it'll be $700 a dose. Okay, how can you do that? Well, we can charge what we want. It's just that Blue Cross Blue Shield will pay us $6,800 for these doses. And so we set our allowable high enough so we can capture that $6,800. And my problem as an uninsured patient, unless I talk to them and get them to work with me, they expected me to pay that. So anyway, it got dropped by 90%, just like the hospital bill. Wish I could get that discount on all my self-pay. In fact, I usually get about a 30% discount. And some providers are reasonable and some are not. So, like I say, I could tell you a lot more of these examples. I don't think any more are needed, maybe even these, because I think all of you already know this game. So where am I now? I paid $125,000 in Medicare FICA taxes over my career, and I like to think I was a high earner, although as an internist, I wasn't a high earner. I was always happy with my income. But since January of 2019, I've spent $250,000 of my own money. So I've saved the government $131,000. And when I have a couple beers in me, I say, I'm just sure Joe Biden's going to send me a bottle of Dom Perignon. It never arrived, and it's not going to, of course. So how do I see the problem? I am an adherent of the Austrian perspective in economics. I find economics a fascinating subject. And he saw two, there are two things he said that I think are relevant. He called it the socialist calculation problem. He did this in the 1920s when there was a lot of talk about socialism, the future of the world. And then he also, in the 1940s, wrote a book on bureaucracy. So here's his quote: "There can be no economic calculations without market prices. Socialist planners cannot allocate resources rationally because they lack the price mechanism to compare costs and benefits. Insurance companies may be private for-profit entities, but they are setting their rates arbitrarily. They are not negotiating with private practice. They're not negotiating with their customers, their supposed customers, us. They're saying what they're going to pay." And so you have, this was Mises' talk about the socialist calculation problem. Communists don't know what to charge because they own it and they pay for it. And that's where we are now. The prices that are set by practices, the charge master rate is just simply an opening negotiating tool. has nothing to do with the real cost of things, because they routinely accept 50% or more discount, and Medicare pays them probably 30 or 25%. Medicaid pays them 20% or less. And so the problem is right now is that a bureaucracy sets all those prices. And it's all rule-based. There's no interaction with doctors or patients. It's all rule-based. It makes no adjustment for when you need more of one service and less of another. Of course, the real driving force of this is federal laws and federal payments, payer systems. I think Twyla just said that over 40% of payments to the healthcare system are by the government. So not only the tax laws pretty much say that there's a tremendous price advantage to employer-based insurance. Obamacare supposedly was going to make it a private insurance market, but it's just even worse. If you noted, I paid more for my inadequate Obamacare policy than I did for my Blue Cross Blue Shield policy when I was in that gap, when I was after I closed my practice. So what's the way out? I am going to not give any definite solutions except to say we should look at every rule and regulation, and we should say, is this multiplying our choices of how we pay for care, or is it decreasing our choices? And if it's decreasing our options, we should say no more. We should only be changing rules to increase how we pay for it. And perhaps someday there will be more people like me who feel safe to go without insurance. That would be my hope, but I realize that's not practical for a lot of people. Partly they're just scared because they don't, they don't have HSAs, they don't have any alternatives. We don't have any alternatives, and we should have more alternatives. But that's my story, and I hope that sharing it with people would in some way be helpful to you, and I will sit down. Thank you.